Okay, thanks very much, Raj, and to everyone organizing this event. I'm delighted to be presenting here. And my talk is on the emotional and behavioral difficulties triggered by the school closures in the pandemic in particular. We are all aware that the pandemic has drastically changed children's lives, and school closures and also the closure of childcare settings is one of the major factors affecting children. There has been a lot of attention on the impact of school closures for children's learning and the learning loss that Raj has already mentioned. But we have growing evidence of the negative implications of the pandemic for mental health of children. And I have at the bottom of my slides just two descriptive facts about this. One early study showing that even between April and May 2020, at the beginning of the pandemic, primary school age children experience large increases in conduct problems and hyperactivity. And secondly, from the Mental Health of Children and Young People survey, found that comparing the year 2017, before the pandemic, 1 in 10 children had mental health problems, and this rose to 16% of children in July 2020. So quite stark increases in mental health problems. Why that may be, we can all kind of speculate and imagine. Of course, there was a lot of anxiety about health and family circumstances. Children lost their daily routines. Very importantly, they lost the ability to interact with other children and other adults, fewer opportunities for play, fewer opportunities for stimulation, really. And in those cases where the home environments were unfavorable for the children, there was a higher exposure of children to those home environments by having to stay at home. And hand in hand with this comes the fact that parents' mental health was also affected by the pandemic. And we know from other research that domestic abuse went up. And so children were all amongst this, of course. And the change to homeschooling from face-to-face schooling also must have been a challenge for many children. So in what I'm going to talk about, I'm going from the overall effect of the pandemic and honing into the effect of school closures in particular. As Raj already said, we still have not school closures going on, but actually children missing school because of the pandemic. 12% of children were absent from school last week, and many of those for pandemic-related reasons. But school closures are also going to be relevant into the future. There are weather events, holidays, strikes, and so on. Ironically, in my own case, after my children went back to school in September, and I was happy about that, shortly after that, there was an electrical fault and school was closed for a week. So school closures happen and children are absent from school, and it's important to think about. And also we want to know what the legacy of the pandemic is and how to go towards recovery. Are the problems short run or longer run? What are the inequalities like? And in terms of previous research, there have been descriptions of the mental health effect, but not really any causal evidence. The only other really causal paper we found on school closures was in Japan, and this looked at weight problems in children, which increased. And it's very likely that this is also the case in the UK. But very little causal evidence about the mental health and school closures available so far. So I'm going to talk about our own research. We published a report. You can see the picture on the left-hand side, and it also mentions my co-authors, Joe Blanton, Claire Crawford, and Laura Fumagalli. And just to give you an idea of how we're going to go about identifying the effect of school closures, we're using the situation in the summer of 2020, if you remember back to it, where after the school closures early in the year, in June, there was government guidance to prioritize some year groups to come back to school before the summer holiday, reception year 1 and year 6. So these children potentially received 6 weeks of extra schooling that other children didn't get. So we can compare the mental health between those with and without access to school. This is basically what we're doing in our research. The data that we use, unsurprisingly, because this is an Understanding Society event, is Understanding Society and the COVID-19 study. And I guess in this context, I don't have to go into detail of what Understanding Society is. The COVID study, just to remind everyone, is the online survey, which was set up very quickly and early on in the pandemic and has run monthly from April 2020 and then bi-monthly from September 2020 and finished in the summer of 2021. The way we are going to measure mental health here is through emotional and behavioral problems. And this is measured using the Strength and Difficulties Questionnaire, which is a behavioral screening questionnaire designed for children and young people, aged 3 to 16. And the main component is a list of 25 psychological attributes, which are split into 5 different domains. And I'll show you the questions in a minute. And parents answer this on behalf of their children and indicate if the description given is true, somewhat true, or certainly true, or for some questions, it's never, sometimes, or all of the time. So this is a lot of writing. I'm not expecting anyone to be able to read this very quickly, but just to show you that there are 4 domains that are difficulties: conduct, emotional, hyperactivity, and peer relationships. And there's one in red, which is a strength, which is the pro-social behavior. And just to point out, just so you get a flavor, in the conduct problems, one of those problems is temper tantrums. Emotional symptoms, has many worried, often seems worried. And the parent then assesses whether that's the time and how the case and how often. In terms of the data that we use, we focus mainly on the July 2020 survey for reasons that will become clear later on. We use the fact that the Strength and Difficulty questionnaire was also collected from parents for kids aged 5 and 8 in the main Understanding Society study. Excuse me. So we have pre-pandemic measures observed a few years before. And this allows us to compare pre-pandemic to pandemic mental health. And our main sample has just under 2,000 children in England, and we focus on children aged 5 to 11 and look at mother-reported SDQ in July 2020 and in pre-pandemic years relating to the same time of the year, the summer holidays. Right. So just to give you a flavor of the data, comparing the SDQ during the pandemic and in the pre-pandemic years. So this is nothing to do with school closures as yet. We have, you can see in the blue lines is the pandemic in the summer 2020, and the orange is in the years before. And focusing on the difficulties, you can see that the difficulties generally have gone up. So the blue bars are longer, and the total difficulty score summarizes all of that. And the pro-social behavior, on the other hand, has gone down, so has got worse in the course of the pandemic. As I said, this is just the overall change in mental health of children, and we are going to look at school closures in particular. So to understand a little bit better how we do that, we have I've got this timeline for you, which starts on the dreaded day, 23rd of March 2020, excuse me, where the schools were suddenly closed for all children except vulnerable and children of key workers. Then on the 1st of June, we have primary schools advised to reopen for some children in reception year 1 and year 6. And then towards mid-July, the summer holidays start, everyone's in summer holiday. And then shortly after, after the first week of the holiday, we have the survey. Later on in September 2020, everyone goes back to school, but some schools are closed because of bubbles, things like those around COVID outbreaks. And then we have another survey, which collects SDQ at the end of September. So we compare the change in SDQ to pre-pandemic years between children who were and were not prioritized to go back to school. And here you see our main results in this graph. Focus maybe on the total difficulties first. What this graph shows is that priority groups compared to non-priority groups, the problems of the non-priority groups were too higher than of the priority groups. And you can think of this as an example, thinking back to the tantrums. If a parent said their child never had any tantrums, this child has now gone to having tantrums all of the time, or a mixture of two other problems that have occurred some of the time. And looking at the domains within the total difficulties, you can see that this is driven by conduct problems and by hyperactivity, whereas emotional symptoms and peer problems are unaffected. Looking at the pro-social behavior, which is the strength, that has gone down by one. So one of the strengths has basically disappeared for those that were not prioritized to school. In terms of standard deviations, if that's kind of a metric that you work in, it was 40% of a standard deviation rise in the total difficulties for the non-priority group compared to the priority group. And I'm giving you this number mainly because it allows us to compare the size of this effect to the learning loss, which has been estimated after the first lockdown for students in year 2 as 15% of a standard deviation. So just going by this, it looks as though the mental health problems are considerable, just comparing this size, and possibly larger than the learning loss. What I want to show you also, so far we've been talking about the effect of government guidance, but the guidance wasn't followed exactly. So it's quite interesting to also look at what actually happened to attendance. And we have survey information from September on this. If you focus just on the left-hand side here where my cursor is hovering, you can see that among those that were in the priority group, that's the lighter bar, 80% of children were actually offered school. So not all schools did what they were asked. And not all parents actually decided to send their children. It's about 70% of children that then went back when offered school. And looking at the groups that were not priority groups, some of them actually were invited back, 30% of children, and most of them actually also went. And on the right-hand side, you can see how that breaks down for the different year groups. So this is to say that there's about a 40 percentage point difference in whether children in attendance between priority and non-priority groups. And this means that if we look at the effect of attendance in our estimates, that would suggest a much higher effect of not being prioritized to go back to school. Meaning that the estimates I've presented of the government guidance as opposed to school attendance were kind of a lower bound of what we expect the problems to be. So this is actually quite concerning size of a mental health effect for a relatively short closure. We're talking about 7 weeks difference in schooling. Obviously, we're very interested in the effects by the background of the students. But the sample size limits what we can do here, how much we can split the sample. We have looked at it by gender and find that boys are more affected than girls. And interestingly, the girls seem to be less affected because they do have more problems, but there's also one problem that gets smaller for them, and that's peer relationships. Obviously, when school closes, you know, the interaction with peers by necessity has gone down, and it seems that these preteen girls seem to benefit from that to some extent, having fewer peer problems. One really important thing that we want to ask is what happens in the longer term. So the estimates that I've shown so far were from the first week, after the first week of the summer holiday. And now the next thing that we do is we look at the end of September. So this is the time where all the children have been back at school for 4 weeks already. And we look at, do we still see differences in mental health between those that did and didn't get offered the chance to be in school for 7 more weeks in the summer? And we actually find that those differences still persist. So the long summer holidays and being back in school for 4 weeks has not changed the fact that the mental health was different between the summer priority and non-priority groups. And this suggests that recovery is not automatic. So just being back at school with everybody else does not wipe these problems out, which is a worrying fact. And just to highlight also that we look at school closures for 7 weeks, and we don't know what happened. Schools were closed for about 18 weeks for most children, so effects may accumulate or even exacerbate across successive closure periods, and we don't have any evidence on that. So what are the implications for policy? We find large and quite persistent mental health effects of school closures. And so far, the education recovery policies have focused mainly on learning loss. But given that we know there's a close link between child mental health and educational attainment, we think that even from the point of view of learning loss, so even if you put aside the fact that obviously you don't want children's mental health to decline in the way that it has, we think there's a strong justification also from an education point of view to focus on mental health. It's very important to prioritize access to school, and I think everyone has understood that now, and to prioritize also extracurricular and after-school activities and summer holiday clubs. We need funding for mental health services that offer early interventions and integrated services, integrated with other services. There needs to be training of staff because it is the schools that are the point of contact. So they need to link up the children to existing and new provision of mental health support. And already mental health is a focus in the curriculum, which is also quite important. There's a dedicated mental well-being curriculum, but mental health can also be integrated in all subject areas where when you do your physics experiments, you collaborate with others and learn to interact again, for example. Another thing that came out from our research was actually vaccine advice, where we had, this is a little bit of bragging actually, where we had direct input on the decision to vaccinate 12 to 15-year-olds because of the mental health effect of school closures. Right, this is all from me. I'm looking forward to questions and also to hear from Nicola about the learning side of things. And I'll stop sharing here.